it's Dr. Kirsten Ln, Chiropractic. We're back this week to talk about an important topic that's been flying around on social media a lot again in the last week or two. There's a lot of people asking questions about the possibility of stroke with chiropractic care or cracking your neck at home. There's been a couple of recent articles pointing to people actually having strokes just from cracking their own neck. And it's really important that we understand the most recent research that's come out on that. Just a few weeks ago, the Annals of Medicine also released a very large study. We'll put links in the descriptions below with several studies that you guys can read through if you want. But I'll talk you through what the studies actually tell us right now. There is no increased risk for stroke with cervical manipulation, cracking your neck, chiropractor doing it, anything like that. There are certain small risks that do come with any type of treatment with physical medicine for your musculoskeletal system, but stroke isn't one of them. The stroke is already happening in these people, causing neck pain, headaches, other symptoms that they might have been trying to alleviate by cracking their neck or going to a healthcare provider to do that. So whether somebody visits their chiropractor with those symptoms, visits their MD with those same symptoms, or just tries self-manipulating their own neck, the incidence of stroke is exactly the same. Okay, and it's really important to understand that. Now, that being said, what we do in a chiropractic office isn't without any risk. So it's really important, if you are going to seek chiropractic care for these types of issues, that you get a thorough exam. There's a very small part of the population that shouldn't get their neck adjusted. It's extremely small, it's very low risk, but some people should not have their neck adjusted. So if you aren't getting a full exam, including orthopedic testing, special tests like a Hintz exam or a Declan's test for cervical vertebral artery insufficiency, you might want to ask about those and see why your provider has chosen to do those or not. If you're ever hesitant about cervical manipulation, talk through and ask about those questions with the provider that you're dealing with. But it is a safe and effective way. It actually carries much less risk than many other more invasive treatments for cervical pain and headache, like medications, whether oral or injectable, and surgery. So we got to look at this from perspective. There's tons of literature out on it at this point. It's one of the safest treatments that you can have for neck pain and headaches with the fewest amount of side effects. But there are a few people that should not get it done. For those people, we want to catch them. If we think we're having a stroke due to history, we're going to do some special tests to try to verify that and get that person to the hospital as soon as possible without performing manipulation on their neck. But to say that somehow we're worried about this causing stroke really just doesn't make sense. That's like saying that, you know, you must be nuts to a cardiologist because all their patients have heart attacks. That's just silly. No one would ever say that. So please comment down below. Give us a like if you like this type of research being brought to you so that you know what's a safe and effective type of treatment, or comment and let us know if you have questions. We'd love to answer them for you here at Venture Chiropractic. Remember, we're always here to help you move better, feel better, be a better you.
Everybody's moving, everybody's moving, everybody's moving, 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 moving. Everybody's moving, everybody's moving, everybody's moving, 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 and stop.